Again, a very warm welcome to all of you. Today, we are with you with a new topic that is pyelonephritis. Basically, this topic I will put under the category of fourth year therapy, internal medicine. But in all the subjects, whether it is pathological physiology, pathological anatomy, this topic will be the same. And we also discuss up from the pharmacological point of view that what drugs we should give to the patient when he or she suffering from pyelonephritis. Now the first question, what is the definition of pyelonephritis? What does it mean, pyelonephritis? So pyelonephritis is basically the inflammation of kidney. It is the inflammation of kidney and pelvis. From the path anatomy, we know that it is a tubulointerstitial disease in which the inflammation of two parts take place. First part is tubules and second part is interstitial part of kidney. Interstitial part of kidney. So we have interstitial tissue and tubules damage. So this is the definition of pyelonephritis. Then what are the types of pyelonephritis? We know we have basically two types generally what we know, acute pyelonephritis and chronic pyelonephritis. But there is also one special type, we must remember it. The name of that part is tuberculous. That is tuberculous. So means when there is tuberculosis related to kidney, the patient is suffering from tuberculous pyelonephritis. So I want to give you the idea regarding tuberculous pyelonephritis. Tuberculous pyelonephritis of kidney occurs due to hematogenous spread of infection. Which route? Hematogenous route. No, in detail I will discuss that acute pyelonephritis and chronic pyelonephritis, what is the route of their transmission. For tuberculosis type, the route is hematogenous route, means via blood. Most often the site is from the lungs and it may result from ascending infection from tuberculosis of genitourinary system such as epididymis and fallopian tubes. If patient is suffering from this disease, then what can be the clinical features? So patient will have pyuria, hematuria, and this hematuria is microscopic, we cannot see this by eyes. The mild proteinuria, we can see mild proteinuria, and we must give effective antibiotic therapy for such patient. Now, acute pyelonephritis. We have already discussed about the definition of pyelonephritis, that it is the inflammation of kidney. But for acute pyelonephritis, this is, we can say, suppurative inflammation of kidney which is caused by pyogenic bacteria. Mainly this is caused by E. coli in the inpatient department and outpatient department, whether the patient admitted to the hospital and whether taking medication and return to the home from the OPD. So the main is E. coli. They also we have S. aureus, and we also have many bacteria such as Pseudomonas aeruginosa. Like this we have different bacteria. We also have Enterobacter, Klebsiella, Pseudomonas and Proteus. So this is the etiology. And for pathogenesis, I already told you I will discuss in detail what are the pathogenetic mechanism and route of transmission. But before this, I want to discuss about risk factors. What are the risk factors for pyelonephritis? Who is at high risk for pyelonephritis? The people with advanced age, means elder peoples or senile age peoples are at high risk. Females are at high risk. Why? question mark. Remember, in females, the anus is in close proximity with urethra. So, what it causes? It causes the transmission of normal microflora of colon to the urethra, and we know these normal microflora, when reach there, these bacteria when reach there induce inflammation, pregnancy, diabetes mellitus, immunocompromised state, means when patient is suffering from any disease earlier and the body become very weak, the immunity become weak, and any opportunistic pathogen, any opportunistic bacteria can induce such risk factors. Autoimmune disorders, congenital anomalies, renal stones, and tumor, these comes under the category of obstruction. Under the category of obstruction, because we know whether it is a stone or a tumor, it will block. So we finish with the risk factor. Now this is the pathogenesis for acute pyelonephritis. So for acute pyelonephritis, we have two routes. One is ascending route and one is hematogenous route. Let's discuss first about ascending route. Let me give you information that ascending route is the most common route of infection. The common pathogenic microorganisms which are inhabitants of the colon may cause fecal contamination of urethral orifice. As I told you, now in females the urethra and anus are in close proximity. So what it causes? It leads to bacteremia, and this has been attributed to shorter urethra in females. Why it is so? Because shorter urethra in females and also children's, and there is hormonal influence facilitating bacterial adhere to mucosa. There is bacterial adhere to mucosa. These bacterial adherence means attachment, the attachment of bacteria to the mucosa under the hormonal effects, and maybe any urethral trauma, any injury. Yes, sometimes injury leads during sexual intercourse. And the last name produced, which is approximately, it's very interesting, it's very nice to say, but we can say we have one disease, that is honeymoon pyelitis. Honeymoon pyelitis, when after the marriage the husband and wife go to the honeymoon and enjoy their night, and during their sexual intercourse maybe they become very aggressive and they do not think about their situation, like about their primary health conditions, and it leads to trauma of urethra. So heavy sexual intercourse is responsible for severe urethra trauma. Bacteria multiply in the urinary bladder and do not see any symptoms. But now the question is, why it is called ascending route of transmission? This is called ascending route of transmission because the bacteria come in contact with urinary bladder, then pass to the urethra, and through the urethra, by the help of ureter, it pass to the kidney. That's why it is ascending, means it is against the blood flow or against the urine flow. So we finish with ascending type of infection. Then we have another infection or another route of transmission, that is hematogenous. What does it mean, hematogenous? Hem means blood, means transmission of this infection via blood. So in this case, patient have some obstructive lesions in the urinary tract or maybe immunosuppressed patient. Now, ascending is very common. Around 70% infections are caused by this, around 25 to 30% by hematogenous route. Why hematogenous route can cause and how they cause this route of transmission? See, we know our heart pumps blood. When our heart pumps blood, it reaches to the kidney. Around 20 to 25% of blood pumped by the heart reach to our kidneys, and if bacteria present in our bloodstream, then through the flowing blood it can easily reach to our kidney and it causes primary bacteremia, and this primary bacteremia further induce inflammation changes, and these inflammatory changes will lead to pyelonephritis. So we have two route of transmission, one is ascending and one is hematogenous. We completely understand the pathology behind them. Now, if patient is suffering from acute pyelonephritis, what will be the clinical picture? Means what symptoms will patient show? This is spelling mistake. This is fever. We have fever with chills, means shivering. Simply we can say shivering effect. Patient will have land pain and back pain. Patient will also have abdominal colic pain, lumbar tenderness, dysuria. What does it mean, dysuria? Dysuria means discomfort during urination or burning sensation during urination. Presence of pus cells. You cannot see pus cells. Pus cells must be seen by laboratory examination. Frequency of urination will be increased. Nocturia, it means during the night the patient will feel more urination. And suprapubic comfort. So these are the clinical pictures with the acute pyelonephritis. Now we finish this clinical picture. Now what are the complications? The first complications with acute pyelonephritis is papillary necrosis. Papillary necrosis. So this is not the severe complication of acute pyelonephritis. What does it's severe? Necrosis, it's severe. But what does I mean? I mean it is not primarily associated with the disease. Papillary necrosis is caused by mainly analgesic abuse nephropathies. Next is pyonephrosis. What does it mean, pyonephrosis? Pyonephrosis means abscess in kidney. So in acute pyelonephritis, particularly in case of obstruction, when inability to drainage this abscess, no drainage of this abscess, then this condition of kidney is called pyonephritis, means multilocular sac filled with pus is called pyonephritis. Then we have perinephric abscess, means the abscess is present in the kidney, may extend through the capsule of kidney into the perinephric tissue and form perinephric abscess. So we finish with the complication of acute pyelonephritis. We have already understood what is the definition of acute pyelonephritis, what is the clinical picture, what can be the complications, and what are the risk factors of acute pyelonephritis. Now, the next topic is chronic pyelonephritis. We know initially the patient is suffering from acute pyelonephritis due to the contacts with the bacteria, and the main reason for these pyelonephritis is urinary tract infections, and these urinary tract infections are mainly caused by bacteria, and pyelonephritis is the upper urinary tract infection because lower urinary tract infection is called cystitis. So chronic pyelonephritis, this is the repeated attacks of inflammation and scarring of tissues. Like we already discussed, for acute pyelonephritis, we have two routes or two pathogenic mechanisms, ascending and hematogenous. In the same way, we have two pathogenesis for chronic, that is vesico-ureteral reflex and reflux nephropathy. Like with in detail there, here also we will discuss in detail about this. The first one is reflux nephropathy. So reflux means back. The backflow of urine from the urinary bladder into the ureter is the major cause of chronic pyelonephritis. It is basically found in children, in girls. Why it is found in children and girls? Due to congenital anomalies, or maybe due to absence of intravesical portion of ureter. So ureter is not compressed during act of maturation and the backflow of urine is possible, and this backflow of urine increase in pressure, and this increase in pressure in the renal pelvis, so that the urine is forced into the renal tubules, and when this urine is forced into the renal tubules, it leads to the damage of kidney and leads to scar formation. And I already told you what is chronic pyelonephritis: repeated attacks of inflammation and scarring. So we finish with vesico-ureteral reflex. So it is simple, the backflow of the urine from the urinary bladders to the kidneys by the help of ureters, and the main pathogenic mechanism is increase in pressure, which leads to kidney damage. Next pathway we have, that is vesico-ureteral reflex. Vesico-ureteral reflex is basically the type of obstructive, yes, when there is some obstruction and to the outflow of urine and different level. Now, what is the clinical picture patient with chronic pyelonephritis? So when patient is suffering from chronic pyelonephritis, first of all, remember the patient will suffer from hypertension. Second, all symptoms of acute pyelonephritis. So we can say there will be recurrent fever with chilling. There will be leon and back pain. There will be lumbar tenderness. There will be dysuria, pyuria, bacteriuria, increased frequency of micturition. And for this, the diagnosis is made by intravenous pyelography. For this, whether it is chronic pyelonephritis or acute pyelonephritis, for pyelonephritis, the diagnosis are made by some imaging techniques. We have some laboratory tests. So what are the laboratory tests we include in case of pyelonephritis? So in case of pyelonephritis, we do the culture of the urine samples. We take cells from the urine, and because there is hematuria, and from the hematuria red blood cells are present, and we see the presence of pus. So we see urine dipstics. Urine dipstics shows the presence of pus. So it is the laboratory findings which confirms that patient is suffering from pyelonephritis. We see that laboratory findings with presence of different types of bacteria, mainly E. coli, We can see the bacterial culture when bacteria ratio is 10 to the power 5, more than 10 to the power 5. And we also have some image based techniques, and these image based techniques such as retrograde pyelogram. Yes, we also have CT scan, ultrasound. We also have scintigraphy. We also have, that is also very clear method for the kidney disease, and pyelonephritis is associated primarily with kidney because the final damage in the kidneys. So these are the basic science, and that is 10 to the 5 power 5 ml. And we know it is type of inflammation, so there will be leukocytosis, there will be the increased C protein level, and there will be also the increased in specific gravity less than 1010. Remember this will help you to solve urine analysis during exam, not now. And we also have decrease in some urinary enzymes such as beta 2 microglobulin, such as beta 2 microglobulin and NAG. What does it mean, NAG? It means N-acetyl beta D, N-acetyl beta D glucosaminidase, N-acetyl glucosaminidase. We also have kidney function test and intravenous urography for ultrasound investigation, CT scan, MRI. I already gave you information. Now, what can be the treatment? Now you have patient with pyelonephritis. You identify the patient is suffering from pyelonephritis. What is your final approach? Your final approach, what will be treatment? First of all, ask your patient at complete rest. At complete rest. Ask him to drink more and more water. Drink more and more water. No, these are the physiological treatment. We will ask our patient to do this. But we also must find, are there any primary or secondary diseases which leads to pyelonephritis? Yes, there may be diabetes, there may be renal stones, there may be vaginal infection. Suppose you diagnose the patient is suffering from pyelonephritis, but you don't diagnose the other disease. You are giving treatment for pyelonephritis but not for diabetes. There will be the no use of this treatment. You are giving treatment for pyelonephritis, but you are not doing anything for renal stones, and these renal stones with triggers and rigor and will lead to severe problem, and the condition will be chronic and maybe untreatable sometimes, and patient will lead to death. And we have antimicrobial therapy. In antimicrobial therapy, we have 3 goals. What 3 goals? Goal number 1, eradication of microorganism, means we will remove this microorganism from the patient body. Prevent sepsis condition, and this is urogenital condition, so this sepsis is called urosepsis. Maybe reoccurrence of this disease, so prevent reoccurrence. What will prevent? We need to prevent reoccurrence. And finally, what medicine we should give to the patient? We can give fluoroquinolones. What fluoroquinolones we can give? Such as levofloxacin, ampicillin and amoxicillin we can give to such patients. We can give the combination of trimethoprim with sulfamethoxazole with sulfamethoxazole. Now, I already told you that antimicrobial therapy, it may be short course therapy and maybe long course therapy. And during the long course therapy, we must give low dose to patient. Means because patient need have to this around half to 1 year. So it's your primary task to find the disease, because in future you will be a good doctor. You need to treat patients. Yeah, and that's all information I want to give you about pyelonephritis. But I know it's very night and it's not a time to upload such lectures, but medical education don't have any time, because we know medical field is a very learning field. Patient can be anytime, emergency situation can be anytime. Patient can come to you around 2 a.m, 12 a.m, 1 a.m, and maybe in the early morning 4 a.m. And maybe you finish your shift of 12 hours, 15 hours, maybe 24 hours in surgery department, and the next emergency came, and we don't have any options, we don't have another doctors in department, and you need to treat. And to treat them, you must be habitual from now. If you want to treat them, it's time to study better now. Yes, and I see that different students have different kind of problem even in third year of exams. And somebody asked me that how to answer questions during exam, whether it is a therapy exam, pathological physiological exam, pathological anatomy exam, or pharmacology exam. They don't ask you the deep knowledge, they ask you the basic questions. Means if you know the normal topics, then the definition, what is it, oh this is the disease, what does it mean, what are the risk factor, what can be the complication, what can be the outcomes, what treatment will give to the patient, that's all. And if you study, you will find even in third year or whether it is fourth year, same topic in all the subjects. Simple. If you read pyelonephritis in pathphysio, so your base is strong. There is no need to repeat the theory in pathological anatomy. Just read the macro preparation and micro preparation. If you read pharmacology, the treatment for pyelonephritis, no problem. You finish with the definition of pyelonephritis. You know what is the cause of pyelonephritis, what does it mean pyelonephritis, what can be the complications of pyelonephritis, and what should be the proper treatment. So thank you very much. That's all information I want to give you. Thank you. Goodbye. Have a good luck. So we must stop now.